So many people are taking testosterone these days, and it's almost like they think it's some panacea, some cure-all for everything. And I am not opposed to hormone replacement therapy. It's not what the video is about. What I want you to know is that you need to make sure you're getting all of the markers that you need to look at in order to determine how much you should be taking, if you should be taking it. One of the tests that is not often considered before somebody gets on testosterone replacement or an estrogen replacement is sex hormone binding globulin, SHBG. Sex hormone binding globulin is a protein that carries sex hormones through your blood, and it binds testosterone and it binds estrogen very tightly. So testosterone and estrogen, if sex hormone binding globulins are high, it means the availability of the hormones that you're taking or producing are going to be less. Now, there's essentially for testosterone, there's 3 ways testosterone is going to show up in your bloodstream, and hardly anybody's testing for this. It can be tightly bound to sex hormone binding globulin, which we mentioned. It can be loosely bound to albumin, so that's another lab test that should be considered when looking at how testosterone is going to function in your body, and it could be free. So it's very common for people to look at free testosterone and total testosterone. It's much less common for a provider to look at sex hormone binding globulin, and even more rare that somebody's going to look at albumin levels and their relationship to your bioavailable testosterone. So I'm doing this video basically to say, make sure you're seeing a provider that can look at all the right aspects and looking at all the right markers to determine how you're dosing, to determine the effectiveness, to determine the availability of any testosterone replacement you are getting. But better than that is before you even get onto a replacement, make sure all these factors are considered. There's other ones too. There's your adrenal gland function. There's your nitric oxide levels in your bloodstream, your inflammation levels like high sensitivity C-reactive protein, even like your ferritin levels. There's lots of different things that can affect how your body is going to make and utilize testosterone, as well as how your body would utilize a testosterone or a hormone replacement. Hope you found this helpful. I'm Dr. Dave Morris of Magnolia Medical Center here in Murfreesboro, Tennessee. I've got 3 medical providers here, and they work very hard at getting people to feel well and be well and thrive without the use of drugs and surgery. And hormones can be a big part of that. And this is information I believe people should have. So leave me some likes, leave me some comments below. Let me know what you think about the subject, and hit the follow button. Take care today.